How do new medications help ejaculatory dysfunction? Imagine being able to take control of your sexual health and improve your confidence in the bedroom. New medications are making this possible by targeting the complex mechanisms that regulate ejaculation. These treatments focus on the neurological, psychological, and physiological factors involved in ejaculatory control, especially for men experiencing premature ejaculation. One of the most promising approaches involves combining different medications. For example, clinical studies have shown that using sildenafil, a drug commonly prescribed for erectile dysfunction, together with clomipramine, an antidepressant that affects serotonin levels, can significantly delay ejaculation. This combination helps by addressing both the physical aspect of achieving an erection and the neural pathways that control ejaculation timing. Men report longer ejaculatory latency and improved satisfaction, with safety profiles similar to those of the individual drugs. Selective serotonin reuptake inhibitors, or SSRIs, are another class of medications used to treat ejaculatory issues. Although originally designed for depression, SSRIs like paroxetine and sertraline are often prescribed off-label to help men delay ejaculation. They work by increasing serotonin levels in the brain, which influences the reflex that triggers ejaculation. Newer formulations and dosing strategies aim to maximize benefits and reduce side effects, making them more tolerable for long-term use. Researchers are also exploring drugs that act on central nervous system receptors, such as melanocortin receptor agonists like bremelanotide. These medications stimulate neural pathways involved in sexual arousal and may help men who do not respond well to traditional treatments. While mainly studied for erectile dysfunction and low sexual desire, they show potential for managing ejaculatory dysfunction by modulating brain circuits involved in sexual response. Emerging therapies like gene therapy and regenerative medicine are still in the experimental stage but hold promise for future treatment. These approaches aim to repair nerve damage or improve tissue health, which could enhance overall sexual function. Although primarily focused on erectile issues now, they could eventually benefit men with ejaculatory problems by improving nerve signaling and tissue integrity. Some new treatments also focus on addressing psychological and neurological factors. Since the brain plays a key role in ejaculation, medications that target neurotransmitters and neural pathways can help men whose ejaculatory issues stem from psychological or neurogenic causes. These options provide a more comprehensive approach to treatment, especially for those with underlying mental health or neurological conditions. In the context of fertility and endometriosis, improving ejaculatory control can support male fertility by making ejaculation more reliable and effective. This can help couples trying to conceive by increasing the chances of sperm delivery during intercourse. While endometriosis mainly affects female reproductive health, addressing male factors like ejaculatory dysfunction is essential for a complete fertility plan. It is important to remember that these new medications are not one-size-fits-all solutions. Each person's situation is unique, so treatment should always be personalized and guided by a healthcare professional. Combining medication with behavioral therapy and addressing any underlying health issues can lead to the best outcomes. In summary, new medications help ejaculatory dysfunction by enhancing neural control, improving erectile function, and targeting brain pathways involved in ejaculation. These advances can increase ejaculatory latency, boost confidence, and support fertility efforts. Always consult a healthcare provider to find the safest and most effective approach tailored to your needs.